It's Joe Lamb and Michael Stone, and it's Monday afternoon. Coffee, water, tea, whatever. Wish it was bourbon, but um, we're here. And Dr. Stone has a story to tell.
Well, we were reflecting, Joe, on what it was like to, how the last 18 months has changed us or allowed us to reflect. And I'm drinking out of a coffee mug today, Kuskokwim 300. The Kuskokwim River is the longest river in the United States without a bridge. It's a southern border of the Yukon-Kuskokwim Delta in Alaska. It is a landmass the size of the state of Oregon, and it has only around 55,000 people. The Kuskokwim 300 is a race that is the last warm-up race before the Iditarod, and it is the race with the highest number of native mushers of any race in the world. And you go out, it's usually a couple of weeks before the Iditarod, and it's usually very cold. So I was a race marshal in that, checking dogs for many of the years in the 90s. And thinking about COVID, just generally, I recalled one time I was on a snow machine at about 2 a.m, riding through equivalent of a ground blizzard, lost track of the tail lights of the snow machine that I was following, and recognizing that I'm 50 miles from the place I want to go, Bethel. And suddenly I'm lost. I'm going through drifts, and I'm thrown from the machine. The machine stops. It's minus 20. There's no coverage for any cell type things at the time. And in many ways, that was metaphorically what happened to many folks at the beginning of this time period. I get back on the machine and I realize I need to try to follow my path, but the wind, the 20 plus mile an hour wind, the tracks were gone. So I went to turn around and my front tongs went into overflow ice, which means now I was stuck and I was pulling a 600-pound sled of supplies. And it's 2 a.m. I have a spark plug in my pocket. I have a wrench. And when I'm looking around, I can see 3 sets of eyes watching me. That's where many people went during this COVID period. The uncertainty of that. I'm up to my thighs in snow and I can't move anything. So I begin to unlash the sled and empty the contents about 20 feet up the bank. And it's also important to note that when you're in the middle of frickin' nowhere, it's best that if the snowshoes were on the top of the sled and not the bottom of the sled. But that's a learning point. It's also important to note that if you think that you might get lost, the only food you shouldn't have in your sled is Haagen-Dazs Swiss almond chocolate ice cream, because it's minus 20 anyway. So what are you going to do? But the long and short of it is over the course of the next hour and a half, I emptied the sled, and this is what many people did during this COVID period. They did what they could do. I had to break the bolt to undo the sled, pull the sled back up, eventually move this multiple 100-pound snow machine up out of the overflow ice, repack the sled, reattach everything. And then by then the wind had calmed down enough, and I could kind of, probably through a little bit of inspiration, heavenly inspiration, found my way back to the wide river that was iced over so I could eventually ride into this town of Bethel at 6 a.m, only wishing I'd be like Clint Eastwood smoking a cigar, because I survived all this as I was heading into Bethel, Easy Rider. So my only comment was this: many people through a lot of life experience had to live through tons of uncertainty in conditions that were threatening, with the fear of, and those were wolf eyes. They obviously didn't want my Haagen-Dazs ice cream. With eyes looking at you, and you put one foot in front of the other, made the decision points that you could, and recognize that out of all this, if you're on this call, you've learned a lot about yourself in fears, in resilience, in focus, and looking ahead. When I pulled into this place, they were putting together a search party, and one of the Bethel natives pulled me aside and says, "You're a damned Alaskan now. I only have one question for you. Did you talk to God?" And I had to tell him, yes, I did. And I think many of us, through the whole course of thing, watching loved ones pass, watching the fear in the eyes of our patients, dealing with all the uncertainty and all the contortions that have happened. I think all of us, if we haven't, we will have the opportunity to just sit, contemplate, and connect. And so when you asked me earlier today, what has this COVID period taught me, I reflected on that time many years ago when I was lost in the middle of the tundra at minus 20 below, with 6 eyes looking at me.
Yeah. Well, I think the hardest thing for people may be facing this moment in time. What was your story came to a happy ending.
Yeah.
You got to town.
Yeah.
And a lot of us are desperately hoping that we're in town at the moment. Yeah. But it's not sure that we are.
Yeah.
And, as a couple people have said, I've seen written in a couple articles I've seen written about, have said is, hey, we're not going to know whether we made the right decision about masks, no masks, until about June 14th. And part of that's going to be, what goes on in terms of, did we have a big surge in numbers start showing up 2 weeks after our holiday weekend? And, there's the part of me that wants to remain really positive and hopeful and channel that energy. But there's also the part of me that's like, we've maybe maybe we haven't made the right decision. So it's a tough one. Part of this discussion about knowing and not knowing was, came out of you and I talking yesterday again about, a very specific circumstance, which is, hey, I took the vaccine. About a week later, I got hives, and I've been told never to take the vaccine again. And people have been told that. And what makes that so difficult is that normally, separate from the vaccine, like if we didn't have the vaccine as a possible explanation, as you said yesterday, 50-60% of hives are what we end up diagnosing as idiopathic, meaning we don't know what causes them. And interestingly, the data seems to suggest for people who have had things like hives or rashes after getting the vaccine, that when they have the second dose, less than 50% of those people have a recurrence, which makes you think it's neither immune-based or toxicity-based, because if it was immune-based, you'd kind of expect it to be worse second time around. And, it all depends on the filter that we're looking at things. When we're looking at someone in the emergency room with hives, and we ascribe a case of hives to the vaccine, then the next time we're faced with that, it's easier to say, hey, I've been seeing this. And then you tell a colleague and they go, oh yeah, my colleagues have been seeing this. And now we don't know for sure. And it makes it a little bit hard to make these decisions. And I think, we've talked a lot about uncertainty. We've talked a lot about turmoil. And it's really, how do we try to build certainty back into our model?
No, that's exactly true. And I think a part of it is just being willing to connect again, right? Part of our certainty has been connection with people, and some people have maintained that connection through Zoom, but also we opening it up so people can, so we can hear their stories and their concerns, and through our combined connection, then that becomes certainty, and it starts first. There's certainty at a lot of different levels, and certainty has been disrupted for so many people, and so, how do you connect even better with family, friends, neighbors, hear what they're going through, and then figure out how you're starting to negotiate the awakening of entering back in. And some people, of course, folks who don't believe in the severity of COVID, or just as a cold, they fortunately have not had the issues with seeing the severity of illness, or they haven't lost family members or dear friends. And so this is going to be a gradual, we always say, don't we, Dr. Lamb? We always say if somebody took 2 months to gradually get as bad as they got, they should, in medicine, it's going to take at least 2 months to get better. And I think early in this thing, we've talked about this, putting this in the context of the stages of grief, which had anger and depression down there. that we would be running into kind of in this, or should be coming out of the depression aspect and acceptance aspect now. And I think we're going to have to cut ourselves a break and cut each other slack and cut each other a little grace as we each become, what are we willing to do in the awakening? Are we, what is our masking? What is our habits that allow us to move forward? And having to do that without judgment.
Yeah, absolutely. I mean, that's the hard part, right? You know, and it's funny though, you know, as you said it, as you said things, as you said some of the things about if it took 2 months to get sick, sometimes it's shorter to get out the other side. One of the things that jumped up for me was the thought of Sidney Baker's TAC rules, which if you're sitting on a TAC and you remove one, well, you only get 50% better. But the thought also occurred to me that when you're sitting on a TAC, if you're lucky enough to diagnose what the TAC is, you can get better pretty quick. But you know, I was just faced with the clinical conundrum of someone who seems to have had 4 or 5 TACs, and I'm not sure what the 5th or 6th TAC actually is at this point, which you know, puts me in the context of his other TAC rule, which is if you're sitting on a TAC, it takes a lot of aspirin to make it get better. And I'm looking at the history of this person who I just saw and trying to figure out what the other TAC is. I think for me, the thing that jumped out was in your story of being stuck in the snow in the face of the unknowns, like when it comes to choosing to take a vaccine or not, when it comes to the picture you shared this morning of kind of a restaurant along a walking path and people looking like they were all back to normal and outside and enjoying themselves, that the model of stop, breathe, reflect, and choose is going to be it has to be as much of a new normal. We have to get conscious about that, just as conscious as we do about masking. Because, you know, really, someone up to now has been telling us to wear a mask. And now someone's telling us that not wearing a mask is really up to us. And it's going to be a matter of stopping. And the stop piece is you're only really able to do it when you've identified that you're not where you're supposed to be. Like if your goggles had you blinded, if they were covered with snow and you thought you were still seeing the headlights in front of you, or you thought you were on the right path and thought that they weren't, you would have kept going. So that stopping piece was crucial. And you know, and I think that comes about, we have to understand how where we are differs from where we would like to be. Am I anxious when I'd like to be calm? Am I fearful when I want to be brave? Am I not well when I want to be well? And, you know, one of the things that we're working on at the moment is wellness as more than the simple absence of disease. So, you know, am I kind of in that preclinical phase? You know, I don't have heart disease yet because I haven't had the heart attack, but am I going to have the heart attack in, you know, 6 months and then I'll have heart disease. And yet, do I have an 80%, left main blockage or something? So I think, one of the things we can do is just start going back to the basics, finding a way to assess where we are so we know when we need to stop, creating good maps for what we want and where we want to get to. Then when you stopped, breathe, which is a centering technique, and I'm sure you did some of that. You looked around, you had to get your thoughts under control when you were lost. You stopped, and then you had to reflect upon the choices, because one of the choices was to sit down.
That's true, although that was way down my list.
True, but it was a choice you could have made. Without stopping, breathing, and reflecting, you didn't know what all the choices were to you, right?
No, it's true.
And like you learned, like one choice that you'll never make again is to put the snowshoes on the bottom of the load for the sled.
Yeah,
they'll
that was
always
also
go
a
on
choice.
top.
The other choice would be that I make sure I pack my sled and not have
Yeah.
somebody else pack the sled.
Right.
I didn't know I was taking this sled, right? So there are a lot of life lessons in that little experience that I often reflect on.
But I think, the stop, breathe, reflect, choose is a framework. We've come back to this, a heuristic. It can be, instead of it being the unspoken filter by which we take our behaviors in a day, it becomes the opportunity to fully express ourselves. Like even in conversation. I mean, I'd like to ask the people who are listening to us, how many times today during conversation did they make a deliberate choice about what they were going to say next?
Yeah.
I mean, how many times during a conversation did we stop, breathe, reflect, and then choose what we were going to say next?
Are you saying shoot, ready, aim is not the best way to go?
Right. Right. Or it depends on the circumstance.
Yeah.
That may have worked when the wolf is at 2 feet, but when you're standing in town and you're trying to think how you're going to respond to the man who just told you you're an Alaskan and did you talk to God, the wrong answer may keep you from being invited in for soup.
That's true.
So you're going to choose that answer pretty importantly.
Well, I think you and I both know that this, we both have a feeling that this will be a revealing next 3 years for how we as a population and we as consumers of our own health respond and come out of this. I think you and I both feel that this is going to be a multiple year process in which we get to make a lot of adaptations, and there will be a lot of wrestling with what is right in the setting of the greater known of everything that this pandemic period has wrought. And so I think it's going to require a lot of stop breathing, reflecting, and choosing at so many levels in our life. And I think it's good periodically, more closely, temporally closer together than most of us probably do, is really reflecting on choices and learning from many aspects of this last number of months.
Yeah. Well, you know, we both attended the Institute for Functional Medicine's annual international conference over the weekend, or at least parts of it. And I heard an interesting talk by Dr. Lee Hood up at the Institute for Systems Biology, and his connection with the University of Washington and the Providence system and everything that he's working on. And one of the things that jumped out at me from what he said was, well, first of all, they've got a big data study, which means they're looking at an incredible amount of human beings. They're hoping to look at 1 million human beings and look at their full genome, not just like a 23andMe SNP analysis, but a full genome. And they're going to collect a bejesus amount of information on every one of them. But they're doing something called deep phenotyping. And they're finding, as they're looking into this, they're finding some potential explanations for what's causing long haul syndrome, what's causing persistent symptoms after having the COVID infection. And they were saying that the model that they're proving here is one that's going to be applicable to, post Lyme syndrome, that's going to be applicable to chronic fatigue syndrome, that's going to be applicable to Epstein-Barr virus reactivation, that's going to be relevant to mold, chronic fatigue, mast cell activation syndromes. The lists go on and on and on. And so I think there's some gifts that are going to come out of this, but that gift's coming out because they had prepared, and now they're reflecting about the information that they have, and they're able to start doing something that's going to let them choose some outcomes that may make a difference. And, that conscious piece, and I haven't seen anyone say anything today about whether they were consciously thought about their conversation, but, I think in one of our recent talks, we talked about the metaphor of, our brains are a little bit like the production booth, and the director's like, give me what's showing on camera 1, give me what's showing on camera 2 as we pick what we're going to present outward. Like,
Yeah.
I remember the last time I said this. Oh, it didn't go so well. Yep, we're switching to camera 3, not saying the rest of that. And, that's the whole part of reflecting and choosing and exploring and understanding. And I think the take home is, in this complex world that we're in, I don't think labels are going to work very effectively. I don't think we can talk about red states, blue states, Republicans, Democrats. I don't think we can label people on the basis of their skin color or their nationality or their religion or their gender or their sex or their orientation or any of these things, because in many ways, they're not representative. They don't let you actually see the key pieces that you have to look at. I think the challenge for all of us is going to be to do the hard work and find those touch points. And, we've presented recently a couple 90-minute presentations on Saturday morning with the rest of the Consilience Partnership. And they're here on Facebook Live. And they're also on YouTube. the Joseph Lamb MD channel on YouTube and here at Joseph Lamb MD on Facebook Live. And I think they are good introductions to the work that has to be done. You and I are trying to manage our weeks so we can show up at Harmony Hill this Friday. And there's still a few places left if people want to join us there. And there are still several places left at Feathered Pipe. About half the places are left at Feathered Pipe. So I think the challenge for all of us is to find something that works for us, find a model that works. And if what Dr. Stone and I have expressed to you sounds interesting, then come join us and play at either of those two places. And if the opportunity for you to get there this year doesn't exist, well, we're here on Mondays, and the Consilience Partnership will be back late July, August with some more Saturday mornings.
Terrific. And Joe, once again, it's been a great coffee break. Let's figure out what we're going to say next week, and we will have been able to spend some really quality time with folks at Harmony Hill and with some self-discovery and small group discovery, and I think it's going to be awesome.
Amen. So be it. Take care, sir.
Take care.